family member enters assisted living, sometimes figuring out how to pay for it can be very confusing. Well, here to help is Jim Tretola, Certified Senior Advisor. Thank you so much for being back with us here.
Oh, you're welcome. Good to see you again.
So this is a very confusing topic, even just deciphering between Medicare and Medicaid. What is the difference?
Well, I'll give you that quick answer. Medicare is a program designed for people over 65 in America, who have worked over 10 years, or they're under 65 and they're disabled. Medicaid is a program, it's a federal program, but it's for people that are really low in income. To have Medicaid, you have to have less than $2,000.
Wow.
In assets.
Right.
So a lot of people, when they're looking to go into assisted living, they think they can go in there on Medicaid. Very, very difficult to do. It takes a while to get on it. When they say spend down the Medicaid, you have to spend down your assets. So if you had a house and you're using the monies from the proceeds of that house, you could, after a couple of years, spend down all or most of it, and you could get down below that. And that's why I do refer people to elder attorneys and financial planners and things like that, so they can do it wisely and follow all the rules. Most of the communities, like I mentioned, will accept it after 2 years of private pay. You want to get those things all ironed out in the beginning, and you want to always be in communication with them on where you are financially.
So when you're dealing with some of these centers, that's part of your job as well, is to help facilitate in terms of payment, how people are going to get on board, and that sort of thing. How did you even get into that?
Well, as far as how they get paid, you need to get into it, because that's just a fact of life. How are they going to do it? I remember I mentioned to you the three kind of things I look at. The last one is financial. That's the big one.
Right.
How are you going to do this?
Right.
If you can't do it, let's talk about those who can't do it.
Right.
We are a compassionate society. If you can't do it, if you need the kind of assistance that you're going to need, you would end up probably in a skilled nursing home on Medicaid.
Okay.
They would still ask you to draw down all your assets,
right,
but you'd be in a skilled nursing home.
Interesting.
Yeah.
So how did you get an interest in this? Why did you want to pursue this? You had mentioned something during COVID sort of inspired you.
With regards to the Medicare side of my business, during COVID, a fellow called me up. He was actually from Florida. He said, "Hey Jim, what are you doing these days?" And I said, "What am I doing? I lost 85% of my business. The assisted livings were shut down to a great degree. There was no visitations, and more importantly, people didn't feel comfortable putting their loved ones in places with people passing away, and more than that, the fear of it. Fear of it. So I did what I had to do to somehow survive. And the fellow called me up and he said, "Look," he says, he says, "you know all the hospitals, you know the assisted livings, you know the nursing homes, the rehabs. Did you ever consider doing Medicare?" I said, "No, I never did." And then something struck me like, why not do it? Why not try and do it? So I did. I got into it, ordered all the courses, did all the studying, passed all the tests, and I was very fortunate that I got hooked up with a fellow who ran an agency in North Jersey, and he had really the right spirit, I think, for how you do things. The man ran a food bank during the pandemic. We had piles 7 feet high of food in our office. They were doing all sorts of things. The social determinants of health, they call it. There's a lot of things people need, besides just money.
Right.
They need food, they need assistance with transportation and things like that. And also what they preached really at his agency with the insurance is we kind of cover all the carriers and all the plans, so we don't push any one kind of insurance. Case in point, I had two gals I went to school with. They ended up with 2 different kinds of insurance.
Wow.
Because one was right for one.
Yeah.
One was right for the other. It's both good insurance. So people ask me all the time, what's the best Medicare? It depends.
Right.
It depends. And you get barraged on TV, especially during the annual enrollment period with ex-football players and starship captains and comedians. You're getting sold in 30 seconds, 15 seconds? Not really. They're just looking to get somebody to sign you on.
Right.
We sit down, we go over your needs. Again, it starts out with medical, budget, what works for you,
Right.
what kind of prescriptions do you take. We feed all that, who your doctors are.
Mm-hmm.
You know, we feed all that into the computers, we research it, and then we come up with options for you to pick from.
And it's really, tell me about the process. Is it a long art? Because I feel like when people hear this, they go, oh, it's going to take forever. Does it though? Does it really?
No, not really.
Yeah.
I mean, that's the things I ask them. We follow all the rules there. We have, just so you know, for anyone out there, someone can't call you on the phone and just ask you if you're interested in Medicare. Don't ever give out your Medicare number to someone on the phone. We get a signed permission slip, if you will. It's called a scope of appointment, which gives us the ability or the to be able to discuss the different plans with you. But we go into who's your doctors. We want to know who they are, because doctors, some are in some networks, some are not in others.
Right.
What are your medicines? We feed them into the computer. Which plans come up the best for your medicines? We also make people aware of particular programs that greatly help people. And I'll give you one example. We've been helping a lot of people out in the last, year or so particularly. There's a program in New Jersey called the New Jersey PAD program. Mm-hmm. PAD stands for Pharmaceutical Assistance for the Aging and Disabled, PAAD, okay? And the unique thing about PAD is that it's a program that's based on your gross income, not your assets. So in other words, you can own $1 million house, have $1 million in your IRA, have 3 cars, doesn't matter. If your gross income for a married couple is less than $59,000 and change, or for a single person less than like $52,000 and change, you get a PAD card. It's a little yellow card you bring to your local pharmacy. You get your prescription medications for $5 and $7.
Wow.
Which is a game changer for a lot of people. So we make no money helping people do this, but it's the right thing to do.
Right.
And it also helps them take advantage of other programs, hearing aids, glasses. They can even get better Medicare plans that will maybe waive the premium, all or part of the premium. So it's a win-win for everybody involved.
That's
and
incredible.
people do that.
Because I feel like there's a lot of information out there that people just don't know about and don't know how to find that information. So having someone like you, I feel
daunting.
like
It's daunting because you're getting people are just trying to sell a lot of stuff, and it can get intimidating, and especially if someone's gotten burnt. I'll give you, for instance, people, they get a call on the phone, they sign up with someone, they switch their plan in the annual enrollment period, which is October 15th to December 7th every year. January comes along, they go to the doctor, and they're told, oh, the doctor doesn't participate in that network anymore.
Ugh.
So they're kind of upset, and they should be.
Yeah.
But someone didn't do them right. You got to do the homework, and you got to research this for them.
What's the most common question that people ask you about in terms of coverage and all of that, would you say? Or what's the question that we should be asking when we're signing up?
You should have someone who's asking you your personal situation. Mm-hmm.
Because everybody's different.
Everybody's different. I had a friend of mine that I had worked with years ago, and he had real health issues. And he asked me about different types of insurance. What's advertised all the time is usually, it's zero this, and you get all this, and you get all that.
Right.
And that may work for some people.
Right.
But when you first turn 65, you have what they call guaranteed acceptance. Okay. You can be in any health condition, any past history of heart attacks or this cancer or whatever, you can get the insurance with no questions asked.
Wow.
So you got to kind of know the rules and make decisions. And the insurance that you take at 65 may not be the same insurance that you're going to take at 80 you may change. You have the ability to do it, but you may change. And also, couples, spouses, husbands and wives, it's not the same insurance for each one. Medicare is an individual insurance.
Program.
It's an individual program. And the other thing I tell people, I get many calls, I'm coming off of my employer's plan, I'm retiring, I moved from another state or another county or whatever. Those all trigger what they call special election periods, and you're able to change insurance. And you want someone who knows the networks, knows the doctors, knows the plans, the programs, and more importantly, if they don't know it right there, they can find out the answer for you and get back to you. So is it a long, drawn-out process? No, not if you get all the information.
Right.
It shouldn't take long to do it, but it's not a 5-minute thing either.
What's the biggest misconception about this whole process?
That everything should be free, and it's not.
Yeah.
Medicare, going to my other business, Medicare doesn't pay for long-term living of any kind. Now, if you go into an assisted living or a nursing home or your home, the Medicare works and behaves exactly as it does if you're home. It'll pay for your medicines, your doctors, your physical, occupational, speech therapy, all the things it pays for if you still lived home, it will take care of. But it doesn't pay for long-term living.
And that's where long-term care insurance could help out. That's where those kinds of finances can also help out.
And I do refer, again, I can help people with long-term care insurance. I do refer to, I said, elder attorneys, financial people, all different disciplines. There's so many people out there, and I call them trusted and vetted colleagues because I've gotten to know them, and they do the right things for people that I've referred them to. And that's who I lean on. I have people that will clean out your house, stage it for sale. Some of them are actually realtors, will sell it, will actually help you physically move all your items from your home to the assisted living place.
Wow.
I had a woman go to a woman's house, went through all her little trinkets with her and her clothes and said this should be donated, this should be sold, this maybe we'll throw out, whatever. Helped her emotionally through this, pare down, and helped her move in to her new apartment. So there's a lot of different components that there's people out there. I mean, they get paid for it, and they should, but they take a lot of the stress and anxiety out of it for the family members.
And streamline it. I mean, that's the best way to do it. Where can people find more information about you and your services?
Well, they can always get me at my phone number. My phone number is 908-377-7702. They call, they get me. If they don't get me, I'm helping someone else. Please leave a voicemail. I get back to people very quickly. Or they can go on my website with my insurance. Another way just to get a hold of me, it's www.jimtretolainsurance.com. Tretola, jimtretolainsurance.com. So they can get me there. And if I can't help them, chances are I have someone who can.
I love that. Thank you so much for being here. We appreciate it.
You're welcome. It's good seeing you again.
You too.
Bye-bye.